This is an Eyewitness News special presentation. Holiday alert, Omicron surge.
It's like wildfire, baby, and I just want to be safe.
The Omicron variant is spreading like wildfire, and with Christmas just 3 days away, what has been referred to as the most wonderful time of the year has become the most worrisome.
We're hearing a lot of breakthrough cases. My husband and I are both vaccinated. I got my booster yesterday, but we're still a little bit nervous.
So what do you need to do before seeing family? And what's the best way to get tested? Tonight, we get answers.
Omicron is a real challenge. It's going to be a very challenging few weeks.
Are we going back to March 2020? The answer is absolutely no.
Good evening. Once again, I'm Joe Torres.
And I'm Sandra Bookman. Everyone from the president to the mayor has stressed that this is not 2020. But in many ways, it sure looks and feels like it, from the long lines for testing to Broadway shows and sporting events being canceled.
Simply put, Americans are sick and tired of being sick and tired. During the next half hour, we will talk about how to celebrate the holidays safely, whether you are traveling or having a small get-together.
We'll show you the best ways to get your hands on a home test and when you should self-test if you're visiting family.
We'll also look beyond the holidays. How will the Omicron surge impact the return to school after winter break and the return to work that so many businesses were planning for 2022?
And in just a few minutes, we will be joined by New York City Health Commissioner Dr. Dave Shoxey, who'll be answering your questions.
But we begin with everything we know and don't know about the new Omicron strain, from the symptoms to look out for to how effective the vaccines are.
Like so many others, Tanya McMenamin and her daughters waited in the cold weather for a COVID test after her vaccinated, boosted, and asymptomatic husband tested positive.
It's certainly surprising, and we weren't expecting it because we've all gotten, we've all done our part to get vaccinated, which we thought was really important.
It is important, tremendously important, but the questions surrounding the Omicron variant are as numerous as the people waiting in line for a COVID test. So let's clear up some facts. The highly contagious variant, first identified in mid-November in Africa, spreads like wildfire, doubling in numbers every 2 days.
We estimate that about 73% of cases now are Omicron, and that's up to 90% in some areas of the country, including New York, where you are.
Health experts anticipate the skyrocketing surge to continue through Christmas, with a peak in mid-January.
The goal cannot be to avoid infection at all costs. That's an unrealistic goal. The goal should be prevent deaths and severe illness.
Not everyone will develop symptoms from an Omicron infection, but since exposure is likely, it's important to recognize the variant's more prominent signs, which include cough, fatigue, congestion, and runny nose.
With the vaccination, your chance of being hospitalized, having a severe infection that lands you in the hospital, is still dramatically lower than if you're not vaccinated at all.
Lastly, protection is different than prevention. The high number of breakthrough cases among the fully vaccinated clearly shows that 2 shots and a booster will not fully stop an infection.
The problem we're seeing with Omicron is that the immunity that you get from the vaccines is not as effective as it was with the Delta variant. And so this variant is particularly adept at evading the antibody response.
Regretfully, that is news no one wants to hear.
I thought, like many people, that we were at the tail end of this and things were going to clear up and we were going to be smooth sailing from here on out, but it's had a different plan.
Now, despite the surge, despite Omicron, despite the number of breakthrough cases, health experts say we are way better off this winter than we were last winter. And fingers crossed, the hope is we'll be better off next winter than we are this winter.
One day after President Biden promised to distribute more than 500 million at-home COVID test kits, his administration has no answers about exactly how or when those kits will be delivered. We know that they are not arriving before Christmas or even New Year's. That is why so many people are either standing in long lines to get tested or scouring pharmacy store shelves. Our Nina Pinedo went out searching for at-home tests and found some of the best ways to secure one.
I do apologize.
Sold out and out of stock.
We had 100 kids come in, and within 25 minutes, they were all gone.
Last week, there were hundreds on the wall. Now there's none.
Customers in line at Hudson Drug in Cresskill were in luck because one of pharmacist Yashaw's suppliers confirmed delivery, less than expected because the government took remaining stock, but 48 at-home tests came through.
Do you want a bag? Nope.
Unless an independent store will reserve test kits for you in advance, it's usually first come, first serve. Ask your local store what time they expect shipments or keep trying to add to cart online. It also pays to drive around. The CVS in Millburn was out, but a drive to Union nearby netted 2 tests at Walgreens. You can also order free tests by mail. States like New Jersey teamed up with Vault, offering no-cost saliva tests via expedited mail for all residents. Just beware of online sellers seizing on low supply. We found a box of 2 tests, which should retail around $40, selling for $350 on Craigslist. Remember to pay with a credit card to third parties in case there's a dispute. Price gouging rules are also in effect, which prohibit stores from jacking up short supply prices in a crisis. If you do score a rapid test, follow this doctor's orders.
You have to make sure, one, that obviously it's sealed appropriately. You should read the directions before.
Englewood Health's infectious disease MD says timing is critical. The rapid test is most accurate if you are already symptomatic but not sure if it's COVID or a cold.
The closer to the time is the better. So if you're going to a Christmas lunch or Christmas dinner, a few hours before you go is the time to do it.
Also, important reminder, testing should be done along with, not instead of, other safety precautions.
It's a reasonable mitigation strategy. Now, it doesn't replace masking and distancing and vaccines and everything else.
He notes don't buy up tests like toilet paper. Just like vaccine supply, more will be made available soon.
If you're asymptomatic, you're vaccinated, and you're not going to a gathering, there's no reason to test for the sake of testing.
Ask your insurance company for help getting rapid tests. Cigna uses LabCorp, which had at-home kits for 2-day delivery at $119 a pop. But by simply filling out the form for qualifying conditions, the price went to $0. Just make sure you hang on to your sales receipt so you can submit it for reimbursement. And if you suspect price gouging, take a picture of the item and the cost and alert your local Consumer Affairs Department. In New York City, you can call 311. Nina Pineda, Channel 7, Eyewitness News.
Testing is a key part of the CDC's plan to keep kids in school after the winter break. The so-called test to stay option involves regular testing of students as soon as a positive case is identified in the classroom. If a student tests negative, he or she can remain in school. If they test positive, they must self-isolate. Will it work? Eyewitness News reporter Marcus Solis visited one Dutchess County school district that has employed a test and stay program for months.
So you can pull your mask down.
Angelina Chula is taking a quick test before school. No studying required, just a nasal swab that lasts a few seconds.
It doesn't go all the way up your nose. It didn't hurt. It just felt a little weird for a second.
Every child here has had an exposure to COVID in school. Normally that would require a quarantine period of 10 to 14 days. But the Wappingers Falls Central School District has implemented a test to stay option. An exposed student is given a rapid test in the morning. If it's negative, they can attend classes that day.
I like this because when they have to do the full 10 days, I feel like they get really behind.
The students must be tested for 7 consecutive days. No news is good news, but a positive result means a phone call from the testers.
Your child, we got a positive reading on our test kit. The minute that we know that there's even the hint of a positive, we contact the family and we contact the school district and we let everybody know what's going on so that way everybody implements the plan that we've already set in place.
Since starting the Test to Stay program in early November, some 250 students who would have otherwise been quarantined have been able to attend classes.
Any opportunities we have to keep our kids in school in a safe environment, we're going to take advantage of those. And once we heard from the county that this was something that we could do, we got right on it.
Expect other districts to follow. Governors Hochul and Murphy have indicated Test to Stay protocols will be rolled out in New York and New Jersey.
That is why we're in communication right now with the school superintendents, knowing there's a short break between now and January 1st or January 3rd when the kids are back. And as we've ordered already, 2 million of the tests we have will be going right to the schools.
It's better for them overall. They lost so much time in the past 2 years. It's silly to not do this.
A new approach in an ongoing battle. In Hopewell Junction, Marcus Solis, Channel 7, Eyewitness News.
From classrooms to cubicles, what will your office look like in the new year?
I'm Lauren Glassberg in Midtown, where office buildings won't be filling up anytime soon with office workers. How this new COVID variant is delaying a return to in-person work and what that means for the city coming up.
Also ahead, we'll be joined by New York City Health Commissioner Dr. David Shoxi. We'll ask about how to celebrate the holidays safely and review new research about when this latest surge could end. We'll be right back. Joining us now to discuss the surging Omicron variant in New York City is Health Commissioner Dr. Dave Shoxi. Thank you so much for being with us this evening.
Of course, Sandra. Thanks for having me.
People are traveling for the holidays. Everybody's kind of chiming in on what they think will make for a safe holiday celebration. What are you doing with your family, and what do you recommend to fellow New Yorkers?
Yes, well, look, I certainly recognize this is not the holiday season that any of us had hoped for, but I think there are still ways for us to celebrate and reflect safely and enjoy the season. My most practical tip is plan around your most vulnerable family member, whether it's an older adult, whether it's someone with a weakened immune system, and take steps to help protect them. That could mean gathering virtually in some cases. It could mean moving things outdoors or using precautions like masks and distancing. For my own family, I'll say that we had been planning to travel out of town, but given what's happened with Omicron, and the fact that I have a baby at home who's not yet old enough to get vaccinated, we decided to postpone that, but we'll be meeting up with family locally instead.
Okay. All right. Well, there's also a report today that Omicron cases in South Africa are slowing down considerably. So what should we take from that? What does it mean for us here in New York?
Well, we are still learning about the science of Omicron, so we have to take all of these findings always with a little bit of a grain of salt. But what we're seeing in South Africa was they had a very sharp upslope in cases. That's what we're experiencing in New York City right now. But they also had a relatively rapid descent. Whether that holds for New York City is not definitive at this point. But what I have to say is that we're not powerless against this. We have to do the things that we know work to curb the spread of the virus. Getting vaccinated, getting boosted as soon as you're eligible, wearing a mask, particularly indoors, and staying home if you're sick. All of those things, improving ventilation, doing more things outdoors, all of that will help us to bring that curve down sooner.
Now, Mayor-elect Eric Adams has announced that you will be staying on through March to help with the transition for the next city health commissioner. Where do you think Dr. Ashwin Vasan will need to put his focus first?
Well, first, let me just acknowledge it's been the privilege of a lifetime to serve as health commissioner for New York City during this really extraordinary period in our history. And I'm grateful to the mayor-elect for allowing me to have some continuity as we respond to the Omicron surge. I'm looking forward to working with Dr. Vasan and getting him up to speed on the COVID response, which will remain a major priority. But I know the mayor-elect and he have some big plans, particularly around mental health and addressing chronic diseases as well. And those are passions that I share, so I'll be looking forward to working with them on all of that.
Dr. Shoxi, thank you so much for being with us this evening as we all try to navigate through this.
I appreciate it. Have a good evening.
Coming up next here on Eyewitness News, what you should do if you test positive. It is a question tens of thousands of people grapple with every day. And the Omicron variant may delay your return to the office. We'll tell you how long people may remain remote and the ripple effect it could have on the economy. The question faced by so many people, what are the next steps after testing positive for COVID-19?
Now, the CDC recommends isolating for 10 days from the onset of symptoms, the first day of symptoms counting as day 0.
Next, you should notify close contacts. A close contact is defined as anyone you were with without a mask within a distance of 6 feet for 15 minutes or more.
You should then monitor your symptoms. Doctors say Tylenol and ibuprofen can be used to reduce fevers, body aches, and headaches.
You should also notify your employer. They may have different rules for when you can return to the office.
So many people, however, have been working from home, some since the start of the pandemic, others forced back into remote work after the Delta surge.
Now, Omicron threatens many companies' return to work plans. And as Eyewitness News reporter Lauren Glassberg shows us, this could have a ripple effect on the entire economy.
From Wall Street to Midtown, offices aren't just emptying out for the holidays, they're emptying because of fears of Omicron.
It's a huge impact. No one's coming into the office. People feel very uncertain about what's coming up.
So many businesses had plans to bring more employees back to the office in January, but those plans have been tabled.
It's definitely affected the strategy.
At Bevel, a communications consultancy firm, for example, the desks remain mostly empty.
It's frustrating to know that the cases have been spiking and it's not safe to be together in person right now.
I think everyone, including the businesses, employers, and employees, are feeling very discouraged and very anxious about this new COVID surge.
Catherine Wild runs the nonprofit Partnership for New York City and has been working with the city's largest employers to establish best practices in bringing employees back while the pandemic continues. Omicron is a big setback.
Our latest survey, which was at the end of October, said that they expected that 50% of the office workers would be back in the office by the end of January. Now all that is reversed.
And she says that delay will further cement the new hybrid approach that has been steadily taking hold. In fact, 80% of employers they surveyed said they don't ever expect workers to come back 5 days a week.
Many people have discovered they can be anywhere in the world and get their job in New York City done. That does not help New York City. It's a problem.
Because when workers remain at home, they're spending less money in the city in all sectors, from the subways to the theaters to restaurants.
The brick and mortar economy is really suffering, so they don't have the choice of working remotely.
But for those who do have the choice, working from home will continue until there's greater confidence that coming to work is a safe bet.
We're not requiring anyone to come in. We'd rather have them work from home. And in January, we can reassess and send out guidelines to the entire company.
The pandemic once again disrupting the back to work playbook.
Any plans to return have been shelved, and the few people that have ventured back have just stopped coming.
Best case scenario, this surge is over in a matter of weeks and a return to office en masse can happen sometime this winter. But if this surge continues through January and into February, a return to office may not happen until springtime. In Midtown, Lauren Glassberg, Channel 7 Eyewitness News.
A lot of food for thought. That's going to do it for this Eyewitness News special. If you missed any portion of it, you can watch it. Go to ABC7NY.
On the site, you can also find the latest information about the variant, testing options, and how to celebrate the holidays safely.
Have a great evening and a healthy holiday.